Okay. Well, thank you to be here, first of all. In Vicenza, in Veneto region, we are making a training course for continuing medical education on frail patient.
I'm sorry, what kind of patient?
Frail.
Frail patient.
We are speaking about frailty. We would like to focus more on the importance of having a multidisciplinary approach and a proper exchange of data for this frail patient. Can you suggest something on this topic from your point of view?
Okay, I try to suggest what I think are the most important things to think about.
Can I ask you to speak louder?
Yes,
Sorry.
to think about the most important things
Yeah.
to include in the study. And one of them is not to treat people as though they were diseases. You must be aware of all of their health problems and how they interact. Okay.
Yeah.
Because no two people with diabetes are the same. No two people with COPD are the same. They are different. So you should try to categorize individuals in your populations by some measure of case mix. Okay. And we have tools you can do that. It just requires knowing what all their diagnoses are in a, say, a year period. The second thing is when you are thinking about the intervention, and particularly the different roles of team members, to think about what each type of team person is going to contribute to the primary care functions. Okay. If you're going to hire nurses, what do you expect the nurses to improve in terms of first contact, in terms of comprehensiveness, in terms of person-focused care, in terms of coordination, family-centered, community-oriented? What is the function you want each team member to mostly contribute to? Okay, and I don't mean things like, well, do prevention, do the screening, because prevention by itself doesn't mean anything.
Right.
Yes, unless it helps you in dealing with the frail individual as a person. So those, I think, are the two most important things. Take into account what is the constellation of problems, the morbidity burden, and then what specifically each team member contributes to the functions of primary care.
And do you think that primary care, a multidisciplinary approach of primary care, is much better than a solo practice for this?
It's an empirical question for me. It's not a matter of values.
Yeah.
Okay. If you can do the functions of primary care better with a team, then it's better.
Yeah.
If in fact the solo practitioner feels interfered with by other team members, then it's a bad thing. Because, sometimes you put too many members in a team and you have terrible problem with coordination. Right? So it's not, there's no clear answer to that question. It depends on what you want to contribute and how well the team functions to do those, how well the team works to do those functions.
And the same things, I assume, is for the exchange of data. It's not important to organize the exchanging of data, but which data are supposed to change.
Right. The electronic medical record is a major contribution to care, but it depends what information you put in the record. It's not the record that has any advantage. It's that helps you with information.
How you use it and how you
use it.
Which information you exchange with which person. That is the most important.
That's right. It's, first of all, do they have the patient's problems in there?
Yeah.
Not only the diagnosis, but patient's problems, because you cannot look and see whether the patient improves unless you know what the patient's problem was.
Yeah.
Okay. The problems, the diagnoses, and what you did.
Do you know something about the Italian health system? I'm sure you know quite a lot of Italian
Well,
systems.
I know, but we didn't include Italy in the comparisons because we find that there was no way at that time to characterize the system because it was, 20 different systems.
Right.
So if you ask me, I understand the Italian system, I say, which one?
Right. To give a suggestion for a future of the Italian health system, what can you suggest?
Well, I think maybe you have to start first to describe the health system. And I think you start with primary care. And we know how to describe a health system that's primary care oriented and to tell the difference from one that's not primary care oriented. So you can take your different regions and you can, and we have this PCAT tool which has several different versions. We have a version that you can give in a health survey, like they did in Catalonia. We have a version that you give to patients coming to facilities, like they did in Brazil. We have one that you can give to physicians to see what they're saying. We also have a systems one that can describe the primary care organization in a region. Okay. So you can start with that. In fact, there's somebody in Austria who's now doing that in Austria. He's repeating what we did originally with the international comparison, and he's also using the systems PCAT for Austria. And you could do that in your different regions. It's not expensive. In fact, for the systems tool, you just have to get some experts to answer questions, but you have to choose the experts carefully.
Okay, and you were also suggesting about which are the topic of research that are supposed to be done for the future. We were mentioning this yesterday, looking from the presentation we had, that research is supposed to go mostly on the people needs.
Right. Well, I think the research of the focus will deal not with specific diseases, but will deal with morbidity burdens. The services of the future will be person-focused, based on constellation problems that the patients have. The research of the future will, in fact, not only be based on diagnoses, but will be based on something like the ICPC, which is what is the patient's problem, and did you improve the patient's problem? So along with the hemoglobin A1C or the cataracts or whatever, you in fact have information on whether the patient's problem is improved. Adverse effects. I mean, that whole list that I showed this morning, all of those are things for research in the future.
Yeah, that was one of them. Okay, thank you very much. So first of all, I don't want to burden you. There